of being able to come here and speak with you all tonight about a topic that's near and dear to my heart. I've been working with health equity with the Virginia Department of Health, Office of Minority Health and Health Equity for the last 12 years. So this evening I'd like to talk with you about, briefly share with you some information about advancing health equity for all Virginians. I'd like to talk with you about a tool that we developed. It's called the Health Opportunity Index, and it looks at the root causes of health inequities in geographical areas. I'm going to give you a snapshot of Virginia's Health Opportunity Index, give you some specific Richmond examples, and we'll talk about ways to address health inequities. And I'll give you some examples of what the Virginia Department of Health is doing to address health inequities. So as I said, I'm with the Office of Minority Health and Health Equity. Our vision is to, we want health equity for all Virginians. Our mission is to identify health inequities, assess their root causes, and address them by promoting equitable opportunities to be healthy. And we feel that all Virginians should have the opportunity to make choices that allow them to live long, healthy lives. So, in addressing health equity, the Office of Minority Health does two things. We empower communities and we enhance public health through partnerships to promote health equity. And when we're talking about health equity, we want to be on the same page and understand that health equity is looking at achieving the highest level of health for all of our people. So we also talk a lot about health disparities and health inequities. We want to make sure that we're all on the same page, that we have the same definition of what we're talking about when we say health disparities. When we think about health disparities, we're looking at the differences among specific population groups in disease burden and health outcome rates. When we're looking at health inequity, we're looking at differences in health status and mortality rates of health population groups. And these differences are systemic and avoidable. Therefore, our work is cut out when we want to address health inequities because they are considered unfair and unjust. Unfortunately, communities of color are disproportionately affected by health disparities. Traditional views of health, they attribute health problems to genetics, individual behavior, and access to care. But what we do is we take a little deeper and look at some of the other factors that impact health. When we're thinking about health, we look at the social determinants of health. When we think about the social determinants of health, we're looking at where we live, where we learn, where we work, play, pray, how all of that impacts health. The chart that you see there is the Healthy People 2020's definition of the social determinants of health. So they're thinking that when we look at health, we need to look at the neighborhood and the built environment. How is the environment affecting health? We need to look at health and health care. Do people have access to health care? Do they have quality health care? We look at the social and community context, how the interaction, how's the family, what's the incarceration rate, what's happening within the community. We look at education. Do people all have access to good quality education? What are the factors that impact educational inequities? We also look at economic stability. Are people able to work? Do they have jobs? So those are the factors that combine that we look at when we're looking at health inequities. So when we want to think about this, we need to think about, traditionally when we think about health, they ask questions of how can we promote healthy behavior. But when you look at it from a health equity lens, you're looking at how can the conditions, how can we target the root causes of the condition? So it really puts a different lens as to how we look at health. Okay. So in 2012, our office created its 2012 Virginia Health Equity Report. Within that report was a new feature called the Health Opportunity Index. And this index looked at key social and economic factors that impacted health. And it came up with a score so you could look at geographical areas across the state and see how well that the area is doing. And so the tool was really created for community members such as yourself, individuals and organizations, to really take a look at how all of these factors impact health. Okay. So in creating the Health Opportunity Index, there were 10 factors, social and economic factors, that we looked at. The first factor, oh, the whole chart. Okay. So we looked at educational attainment. How far did a person go to school? Did they graduate? We looked at population density. Is it a rural area or urban area, suburban area? How does that impact health? We looked at the racial diversity. We also looked at material deprivation. Do people have the resources that they need? How do they get back and forth to work? We looked at population churning. How much are people moving in and out of the area? What's the turnover rate for the community? We looked at job participation, looked at how many people are working and how many people are actually looking for. Of course, we looked at income, household income diversity. We also looked at affordable housing and transportation. We looked at the environmental factors and, of course, the commuting patterns as well. And so we evaluated all of these factors to look at their impact on health. Sorry. Okay. So once this analysis process is very in-depth, and so I didn't include all of that information. But once they did the analysis, this is what they came out with for the map of Virginia. Actually, I'm not wondering. The areas in blue. Everybody remember this? The areas with the dark blue, these are the areas that have the highest opportunity to be healthy. These are the areas that have less disease. They live longer. They don't have a burden, as much of a burden with chronic diseases. As you can see, the lighter areas have the lower opportunity to be healthy. And so you can see down here, Southside Virginia, out in Southwest Virginia, the pocket there, and out on the Eastern Shore, those areas have have a lower health opportunity index. You also notice that areas that are within inner city pockets that are in the yellow, they have a lower impact, lower health opportunity. So what we did was we included the Richmond data, and as you can see, unfortunately a large area in Richmond comes up low on the map. You can see all this area, which is the lowest score, the health opportunity index. Then we have some of your area that goes further west in the city that has better health, better life expectancy and all of that. And so these areas with lower scores, the yellows and the light greens, are the areas that we can really look at to implement interventions to get them, the areas to be more healthy. In designing the Health Opportunity Index tool, the baseline factor that they looked at was life expectancy, because you look at all the different factors and compare it against life expectancy. So as you can see for the Richmond area, if you're if you're living in this area, your life expectancy is 72 years or less. And if you're in the area that has the dark blue, it could be as high as 85 plus years. So this really gives us an opportunity to look at what interventions we can put in place to be able to make it so that everybody has an equal opportunity to be healthy. We also looked at persistent poverty. This map here shows persistent poverty throughout Virginia, and there have been some pockets of Virginia that have had persistent poverty for a while. But the area that's in red, the map is small, but the area that's in red has had persistent poverty for decades, starting in the 70s and 80s. And so when we looked at persistent poverty, we looked at poverty rates where it's defined as communities that have greater than 20% of their population living below the federal poverty level. So I included some slides that talked about, that provide data on different disease complications. This is our slide that's on diabetes. And our data comes from the Virginia Health Information System. And what it does, it provides data that it extracts certain conditions, but what it tries to present is data on hospital admissions that were preventable. There's some health codes that they can look at and they go like, okay, that wasn't preventable, but they pull that out, and so all they have here is data on people who were hospitalized, that their condition was deemed that it could be preventable. And as you can see, unfortunately, Richmond, has a great area that has a high rate of hospitalizations that could have been prevented. And so this speaks to the opportunity to understand what the root causes are as to why these differences exist. Is it, lack of access to providers or influence or whatever? So interventions can be put in place to address some of these. So the next few slides are similar that look at that. So it's hypertension. We have a similar pattern. Maybe less of the red, but you still have a good deal of the orange. And it's the same type of data from the Virginia Health Information System. This is Richmond data. We also have information on congestive heart failure as well. And as you can see, the pattern continues. The map at the bottom, of course, shows how Virginia really has a problem. But we highlighted the Richmond area for this presentation. Same thing with percent of low birth weights. They factored out extracted factors that would not be preventable, but they included factors that could be preventable with low birth weights. And so this is the chart. And you can see that there's a trend in the data as to where the strongest problem areas are. So considering all of those factors, what I did was just kind of put some buckets up here and just kind of want you all to kind of think about, these are buckets, areas that maybe we could begin to think about addressing interventions. I've listed like income and employment issues, looking at education, looking at the court systems, looking at the community resources, food insecurity. Also looking at the isms, classism, racism, sexism, how all of those factors can affect health inequities, community planning, healthcare access, and that sort of thing. So are there areas when you take a look up here, anything that's not there that you think of that could be there, should be there?
How do you address the political system in general?
The political system?
In general, yeah.
Yeah, that's...
Because my business is, when we speak about health inequities, the foundation from all of them is based upon the political economic system we're on. Capitalism has certain philosophical and certain principles that is the foundation for all of this. And if you don't deal with the essence of the system, you're going to just deal with reforms. You're not going to overcome anything. So my position is, what is your position on the nature of the capitalist system? It's the system itself. It's the core of all these inequalities. If you don't have another way of how to look at and view each other and nature, you probably continue to have the same thing. So I'm just curious in terms of what is our position on capitalism.
Okay, now I am with the Virginia Department of Health.
I'm
sorry. Office of Minority Health and Health.
But even then, as an advocate of
the systems,
the function of the system, how do you view that?
We view all of the systems. We look at actually the public health system as a big bubble that includes all of the systems as factors that can impact health inequities, and strategies need to be developed to address all of the components of the public health system.
Because what he said was very timely. I work for the state. I work for the state, and we're covered under Anthem. Anthem just announced today they're going to be merging with Cigna. They're going to have this mega merger, so that's going to affect us all. See, instead of these two companies, you're going to have less competition. So that, I don't know, our premiums might go up, but should health